Well, let's see. We got to talk about this cover story from August of 2011 in Newsweek magazine. Big cover story. Showed a picture of a guy prepared for open chest surgery. 5 gloved hands coming in from obviously 5 different surgeons with scalpels to cut his chest open, racing with each other to see who was going to get in there first and get the money for the procedure. And the wording, the text said, the most important word to survive a hospital visit. You open it up to the center fold where it directed you. On the left-facing page is a patient in a gown, leaning back and face in terror with his hands in a defensive position, out in front of him in a defensive position, and he's screaming no. On the right-hand facing page, what he's saying no to is a group of 8 different physicians from different specialties coming after him. They're elbowing each other out of the way, trying to get to him before the other one does, to get him as an ATM machine, to use this patient as the ATM machine. Well, I would remind you, and these statistics come from the Center for Disease Control of Atlanta, Georgia, the Journal of the American Medical Association, the U.S. Department of Health and Human Services auditor for Medicare, and so on. Okay, here we go. Each year, medical doctors in America alone kill, injure, and infect 15 million Americans. 5.8 million in hospitals, 9.2 million in private offices and clinics. Then, each month, medical doctors kill 15,000 Medicare patients in hospitals in America. Now, these are patients who go in for non-invasive procedures. One of the more famous ones was Andy Rooney from 60 Minutes. He retired. 30 days later, he was dead. And his cause of death was listed as complications from a minor procedure. The doctors all get a walk. They didn't name the procedure. My guess would have been a colonoscopic exam, and my guess is that they punctured his intestine. He died of peritonitis, infection of the belly. If they can kill an Andy Rooney with a front-page story and say, oh, he died of complications of a minor procedure, and the doctors get a walk, what about yourself? And then they said, in 1998, medical doctors in hospitals alone infect 2 million Americans because they don't wash their hands, simply because they don't wash their hands in between patients. They wear the same white coat, same scrubs, with pus, poop, pee, blood, everything you think of, snot, goo, all over these scrubs and white coats, hanging in their lockers, incubating for days and weeks, between examining rooms and between hospital rooms. We treat pigs better when it comes to preventing infections. And 90,000 of these people die each year, 90,000. So they kill 15,000 Medicare patients each month. They infect 2 million a year, of which 90,000 die. They infect, kill, and injure 15 million Americans each year in their workplace, and doctors don't even get an OSHA ticket. Now, what I want you to do is contact your FDI Youngevity associate and ask them about the July 2002, New England Journal of Medicine, where they say joint replacement surgery for arthritis is worthless. And then in the Journal of the American Medical Association, 4 years later in 2006, Harvard Medical School published another article saying surgery for low back pain, sciatica, restless leg syndrome, degenerative disc disease, and peripheral neuropathies is useless and unnecessary and dangerous. And we have all these lawsuits going around costing us billions of dollars, costing the taxpayer billions of dollars for settlements from the Medicare and Medicaid and Social Security to the victims of these procedures. So I'm urging you to contact your FDA Youngevity associate and say, okay, doc says give him 90 days. Okay, the doctor wants to do bone-to-bone joint replacement surgery. We got bone-to-bone arthritis in our knees. They want to do joint replacement surgery. We're willing to give you FDI Youngevity guys 90 days following Dr. Wallach's principles. And if you fail us, we can always get the surgery. Same thing with back surgery. Why would you submit to back surgery when you can't always get unsurgery, uninfected, unparalyzed, and undead? So I urge you to get the book Dead Doctors Don't Lie. Get the CD, Dead Doctors Don't Lie, and are the best of Dead Doctors Don't Lie. Get the book God Bless America if you're a baby boomer, because it's directed to the epidemics, not the bird flu and the swine flu, but the epidemics of obesity and diabetes, heart disease, kidney failure, cancer, all the things that baby boomers are going to get, Alzheimer's disease, because of advice, misadventures from medical doctors. Then I want you to get the book Wall Street for Kids. Give a FDI longevity business to your kids and grandkids, nieces and nephews. Teach them to protect themselves. Teach them, just like the August 2011 Newsweek cover story says, teach them to say no. Whenever a doctor says, well, you have something swollen in your knee here, let's do some arthroscopic surgery. And the answer is no. An ultrasound will tell you if there's anything fractured or ruptured, and then you can come to an FDI longevity associate. And if they don't know what to do, they can contact me. All right? It's very simple stuff. And give us a chance to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Let us support and promote healthy fat and carbohydrate and sugar metabolism at the cellular level and support and promote healthy blood sugar levels. Let us help you support and promote healthy blood pressure levels and healthy blood flow through blocked arteries. We can help you do these things with a supplement program with no risk of misadventure, danger, and death. Contact your FDI Longevity Associate today. We'll be back with more Truth, Justice, and the FDI Longevity Way, the 90 for Life Crusade on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, we talk a bit about diabetes today, as I've got a CNN headline news story that is headlined, Diabetes Affects Dropout Rate and Lifetime Earnings. And what they're talking about is a study of about 15,000 people. They followed for close to 14 years. Some of these people starting out about 7 years old to when they were about 12 or so. And they looked at them starting in the mid-90s and then surveyed them 3 more times, 1 year later, 7 years later, and then the last time in 2008. And at the final time, most of these people were getting close to the age of 30. And they didn't really distinguish between type 1 or type 2 diabetes. But what they have said in this article that was published in the journal Health Affairs, they say diabetics are contributing to high school dropout rates, reducing lifetime earnings. And what they're saying here is people that are diagnosed with as being diabetic, either type 1 or type 2, in their teen years or young adulthood, they're 6% higher or more likely to drop out of high school. And they also found that there's a likelihood that there's 8 to 13% lower chance that they'll actually go to college. And that says that over the lifetime, a diabetic can lose more than $160,000 in wages. And what they're talking about here is the fact that diabetics miss more work, and because they drop out of school, they don't go to college, so they don't ever make as much money. Is a decline seen in education, education employment earnings for diabetics diagnosed as teenagers or young adults. They say about this translates to about 5,000 high school students that drop out every year. According to the lead researcher here, Jason Fletcher, he is an associate professor with the Division of Health Policy and Administration at Yale's School of Public Health. He says one of our most important findings was the large increases of high school dropouts associated with the growing up with diabetes versus not. So it just points out to the early effects of diabetes. A very severe consequence happens in the early 17th or 18th year that they drop out of school, and that changes their whole life. As far as the wages go, they say consequences of lower wages, and they say also found that, say, a diabetic that earned an average of $35,000 a year can expect to lose $4,000 to $6,000, totaling about $160,000 over a lifetime because of higher rates of absence from work. And then they also cite another study that was done a while back, where they're talking about the impending epidemic of diabetics, according to a study author that was in Health Affairs, Dr. Deneen Voja, Chief Clinical Office for United Health Diabetes Prevention and Control Alliance, says the epidemic of prediabetes and diabetes is the greatest health challenge of the 21st century, bar none. Say there's 28 million people living with diabetes, 80 million pre-diabetics, and they say that'll raise to 100 million in 10 years. That's 50% of the population. So there you go. The impending diabetic epidemic is on its way.
Yeah, well, they've been talking about this for a long time, Doug, because of the 80 million baby boomers come along who follow the doctor's advice. And right now, it's 1 out of 3 Americans, as you point out, have it. They're looking actually to go up to 50%. 2 out of 4, 5 out of 10, 50 out of 100 are going to have diabetes in America. And this is the disease they're looking at to bankrupt America from a health standpoint. It's going to bankrupt us financially because of all the disability and as you point out, lost wages and so forth. And type 2 diabetes, which makes up 98% of the diabetic population in America, is a simple mineral deficiency disease. We learned this back, 60 years ago. And it's absolutely criminal that the medical system doesn't educate people to this effect. That's why we want everybody to get a hold of the book, Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity, but it also discusses type 2 diabetes and the metabolic syndrome and how you can wean yourself off of medication and go back to a normal life with a change of lifestyle and a supplement program. Hell's Kitchen, the book. Get a free CD by the same title when you buy the book. Hell's Kitchen. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Houston, Texas, and Claudine, you're on with Dr. Wallach.
Hello, Claudine, you're on the air.
Yes, Dr. Wallach. I am 65 years old,
Okay.
4'11", 166 pounds. I'm diabetic, hypertensive, high cholesterol. I just came out of hospital, and they told me I have a blockage in my heart, and they offered surgery or a stent, and I refused both. I am on your products, Z-Radical, Omega, EFAs, Glucogel, Tangy Tangerine, Osteo, CM Cream. I wanted to know what else I could add, especially for the blockage.
Okay, well, especially for the blockage, I would add what we call Ultimate Daily Tablets. Ultimate Daily Tablets. They are designed to support and promote healthy blood flow through blocked arteries. They're designed to support and promote healthy blood pressure levels. And we actually have before and after angiograms that show improvement from significant blockage to 100% open. We have angiograms before and after. And so we're very, very excited about this. And so at 166 pounds, to the program you're taking, I would add the Ultimate Daily Tablets. And that would be 3 at breakfast, 3 at lunch, and 3 at dinner, because you do have severe blockages, and they're talking about stents and bypasses. You want to take 9 of those tablets a day, 3 at breakfast, 3 at lunch, 3 at dinner. This is in addition to everything else you're taking. That'll be 2 bottles a month of the Ultimate Daily Tablets. Now, I have to ask you, how much of the sweeties are you taking for your diabetes?
I'm not on sweeties.
Okay, then you should take the sweeties. I would take 3 of those twice a day. That's 2 bottles a month. And be sure you take your blood sugar levels before you medicate yourself, because you will have a significant drop in your blood sugar. So you will have to reduce the amount of medication you're taking, and just do what you've been empowered to do. Follow the doctor's instructions. If your blood sugar goes up, you obviously need more medication. If your blood sugar goes down, you need less medication. And what is your blood sugar normally in the morning?
Normally it's 7.2, but in the hospital they say it went up 7.7.
Okay. Well, obviously, are you in Canada or you're in Texas?
Yes, I'm in Texas.
Okay. Why do they say 7.2? That's a Canadian number. Yeah, that's not correct. Is that the A1C hemoglobin, or is that your blood sugar levels?
That's the A1C.
Yeah, exactly. Okay. I want to know your blood sugar levels. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for FDI Longevity and the 90 for Life Crusade. You do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And let's see here. Doug, let's go right back to Texas and Claudine. Claudine, you still there?
Yes, I am.
Okay. What is your fasting blood sugar in the morning when you take your blood sugar level?
Normally I don't take it in the morning. I take it at night only.
Okay, what is it?
But it's between 100 and 200. It rarely would go past 200.
Okay. All right. And so what I want you to do, I'd like you to start taking your blood sugar in the morning when you wake up. They're before you eat breakfast, because when you take the sweeties along with all your other products, you're going to see a significant drop in your blood sugar. So I don't want you to just blindly take your medication without actually testing your sugar. And then do what you've been taught by the doctor. If your blood sugar is going up, you need more medication. As you know, if your blood sugar is going down, you need less medication. Call me every 2 weeks for sure, but you're welcome to call anytime in between. Okay, Doug, let's go to callers.
All right, let's head to Orlando, Florida. And Kim, you're on with Dr. Wallach.
Well, Kim, you're on the air.
Oh, thank you very much, Dr. Wallach. I have a daughter that has a 12-pound min pin, and she wasn't watching him for a minute, and he ingested part of a feminine whatever product, hygiene product, and he started vomiting shortly after that, and she brought him to the veterinarian a couple days later, and the doctor there put him on anti-vomiting medicine, but she didn't think that was the way to go. And the dog is always extremely hungry, like starving hungry, and she feeds him well. So after she finished the first medicine, the doctor changed it and put him on 3 days ago on Reglan, Reglan. And so she really doesn't want to continue this.
Okay, well, let's stop a minute. Did the dog pass either through his vomiting or out the other end in a bowel movement? Did he pass this personal hygiene product?
She's not sure because she believed that he chewed it, and it's probably hard to see in that way, but he did vomit every time a half hour after eating, after he ingested that product.
Now, is he still vomiting?
Not with the Reglan.
And is he having bowel movements?
Yes, everything's normal bowel movement. Everything is normal except the vomiting. And the doctor gave him an injection of a medicine. I have the name of it here, Cerena, Cerena.
Okay, well, it comes down to if that foreign body was either thrown up or passed through the bowel movement, there shouldn't be any more vomiting. So how long ago did that incident take place?
About 3 weeks ago, doctor.
Okay, well, I would wean that dog off the Reglan, and make sure if it's still vomiting, because if it's still vomiting, the odds are it's still in the stomach, okay, or plugging up something somewhere.
Right.
It doesn't seem right. And so after a couple of weeks, it's time to get off the Reglan. The dog should not be vomiting anymore.
Okay.
Okay. And then what I do is make sure that, what does that dog weigh?
12 pounds, doctor.
Okay. So what I would do is give him a half a scoop of the Arthrodex each day in his food. Arthrodex. That's our complete supplement for dogs and cats and other...
Could you spell that, A?
Arthrodex, Arthrodex. It's one scoop for 25 pounds of body weight, but at 12 pounds would be a half a scoop a day. And but get the dog off of Reglan and see if it starts throwing up again. If it starts throwing up again, that foreign body's still in there. And I would be encouraging the dog to vomit, to throw it up, and get rid of that, whatever it is in there. Let me know what happens after you get the dog off the drugs. We'll be back after these messages.
Yeah.
Okay, Doug, let's go to callers.
All right, let's head to Arkansas. And Clara, you're on with Dr. Wallach.
Well, Clara, you're on the air.
Yes, I want to thank you for your help, Dr. Wallach. I called you about a month ago. I have macular deterioration. I've been on your program about 5 months. And the one eye that was so bad has improved. It's dry, but it's going into the other one. And I just want to see if I'm doing everything that I should be doing.
Okay, how much do you weigh?
145.
Okay. All right, here's what I like to do. You got to get rid of all the bad stuff that contributes to the problem. No fried foods, no exceptions. No processed meats with nitrates and nitrites. That means deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, canned meats, hot dogs, all that's got to go. No oils. That means no margarines, no mayonnaise, no salad dressings, no cooking oils. If you're going to eat canned fish, they have to be packed in water, mustard, or tomato sauce. They cannot be packed in oil. No carbonated drinks during meals, even, an hour before, during, an hour afterwards. Even ones we think of as being benign, like diet drinks, club soda, Perrier water, Pellegrino water, nothing carbonated during meals. And then at 145 pounds of macular degeneration, I would take 2 Healthy Start packs per month. Okay, that's allow you to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that would be accomplished with the 2 Healthy Start packs per month. I would have you take 6 of our selenium a day, Ultimate Selenium. 3 at breakfast, 3 at dinner. That's 2 bottles a month. I would have you take the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. And then lastly, I would get your antioxidant points, your ORAC points, above 100,000 per day. And I would do that with a mixture of the Triple Treat chocolate and the Cell Shield RTQ. And these Triple Treat chocolate, each 2 pieces the size of a pat of butter, will give you 33,876 ORAC points. So 6 of those pieces a day and the 2 Healthy Start packs will get you over that 100,000 ORAC points per day. The Cell Shield RTQ capsules, 2 capsules will give you 15,800 ORAC points. And you can mix and match them. 2 or 3 days a week you can have the chocolate. 2 or 3 days a week you can have the Cell Shield RTQ, or you can have half of one and half of the other on any particular day, as long as you're over that 100,000 ORAC point piece. I would throw in one more thing, and that is the Beyond Juice. I really like the Beyond Juice for eye health, Beyond Juice, and it comes in what we call twin packs. It has a bottle of the Veggie FX and a bottle of the Fruit FX. I take 2 of those 3 times a day. So I go through 3 of those twin packs per month, and really ramps up on the antioxidant points, the beta-carotene, and so forth. And so I take that. That helps me too. And so I'd urge you to do those things. The diet is equally important as a supplement program, because we have to stop the ongoing damage, get rid of all the debris and dead stuff in there, and then also repair what is repairable. And the fact that you've gotten some benefit on your worse eye, that tells you that you're absorbing things. Your urine should be a real bright fluorescent yellow. That tells us you're absorbing things. And don't forget, stay away from the bad stuff and get your ORAC points above 100,000 every day. And call me every couple of weeks if you would, please, Clara. Don't wait too long. Call me every 2 weeks. Give me a progress or lack of progress report. We'll walk you through this. Okay, Doug, let's go to callers.
All right, let's head to Colorado. And Cecilia, you're on with Dr. Wallach.
Cecilia, you're on the air.
Thank you, Dr. Wallach. This is Cecilia, and I am having some real bad problems. I am trying to get off of ibuprofen, and I've been having real severe reaction. The reason why is I had to go through implant surgery, and
Okay, well, stop.
dental implant surgery.
What when you say implant surgery, you're talking about hip replacement, knee replacement?
Dental.
Oh, dental implants. Okay. All right.
It was an accident that happened that required this.
Okay, was
Anyway,
it a car accident or falling down the stairs or what?
No, actually, I was taken to the hospital in an ambulance, and the ambulance people dropped me.
Oh my God.
And I went under the ambulance as they pulled me out. And anyway, so I want to get past that. Anyway, all of my teeth were affected. And
wait a minute. Why were you going to the hospital to get an ambulance?
Because of accident, car accident.
Oh, okay. So you had 2 accidents in one day.
Yes.
Oh my gosh. Okay. Okay.
Anyway.
What do you weigh?
Okay. I'm 160, and I'm 5'6".
Okay. All right. Do you have any other health problems I need to know about?
No,
Diabetes?
I've never had any of these problems except for I've been on your program for years, and I've been on gluten-free, and I'm taking the Ultimate Daily, and I'm taking selenium, and I'm taking PFAs. But my problem is I have severe. I've thrown 2 blood clots. Oh, well, I've tried to get off of this.
All right. Well, here we go. You got your pen and paper?
That again.
You have your pen and paper?
Yes.
Okay. All right. What I want you to do is stay on the program you're on, but I want you to add a couple of things to it. I want you to add the Beyond Tangy Tangerine. I want you to take 2 scoops twice a day. The Beyond Tangy Tangerine. So you're going to need to get 2 of the, well, let's just get 2 Healthy Start packs per month. That'll be simplest. I want you to take 2 scoops of the Ontane Tangerine at breakfast and 2 scoops of the Ontane Tangerine dinner. I want you to take 1 ounce of the Osteo FX Plus at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. That's in addition to everything else you're doing. And the Glucogel you're already taking. You want to make sure that you're taking 15 a day, 5 at breakfast, lunch, and dinner. Now, for the pain, what I want you to do is do 2 things. Number 1, I want you to use the CM cream, and I want you to use the CM cream behind your ear where the facial nerve comes out from your skull and goes around the side of your face. I want you to use the CM cream behind your ear, down in your ear with a Q-tip, about a quarter to a half a teaspoon in each ear, say 3 times a day, a fingerful, a dollop, I guess they call it, behind your ear of the CM cream on each side. And then I want you to take the CM Plus capsules, 3 of those twice a day. That's going to relieve inflammation, going to relieve pain. And I want you to call me every 2 weeks. You're welcome to call more frequently, but don't wait longer than 2 weeks because you should not have to be in pain. But this is something that should resolve itself fairly quickly. Because trauma is a healable thing. Your body has a wonderful process that can heal itself given the right raw materials. We'll be back with more Truth, Justice, and the FDI Longevity Way after these messages. Back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for the FDI Longevity 90 for Life Crusade. And Doug, let's go to callers.
Let's head to North Dakota. And David, you're on with Dr. Wallach.
Well, David, you're on the air.
Hi, Doc. Thanks for taking my call.
You bet. How can I help you, sir?
I've had irritable bowel syndrome for about 40 years, and as you can imagine, it's been a long road for that period of time. But,
sounds like it. My goodness. What have the doctors done for you for 40 years with IBS?
Nothing really to speak of. I had a muscle relaxant at one point in my teens when I was first diagnosed, to help with the cramping and that kind of thing.
Sure.
And other than that, I've kind of been on my own trying to educate myself. And
anything else I need to know about? Do you have any skin problems or chronic respiratory stuff, asthma, bronchitis?
No. I also have a lot of cramping, and I'm assuming back pain, neck pain, back pain. I'm assuming that maybe that's a calcium issue. But
yeah. Do you have anything like diabetes or high blood pressure?
No.
Okay. So do you have the constipation version or the diarrhea version?
Alternating. It's been more of a solid stool in recent years, but it'll alternate.
All right. What do you weigh, sir?
Constipation.
Yeah, what do you weigh?
Sorry?
What do you weigh?
173.
Okay, and how tall are you, sir?
5'11".
All right. Here's what I recommend. There's 3 things we have to do here. Number 1, stop the ongoing damage, which is a slowly progressive thing. And then we need to get rid of the debris and junk out of the way that's built up over time. And then we need to heal and repair and all that kind of stuff, okay? We're going to do all this simultaneously. This will go actually fairly rapidly, even though you've had irritable bowel syndrome or IBS for 40 years. This is one of the more severe forms of gluten intolerance. And it depends on what you eat. If you stay away from gluten, this will go away in 4 to 6 months because you've had it for so long. People who've only recognized they've had it for a couple of years, sometimes 30 to 60 days. But we're looking here at maybe 6 to 9 months for this to be completely healed. But within weeks sometimes you'll see some benefit here. So number 1, we've got to get rid of the bad stuff that's caused the ongoing damage. No fried foods whatsoever. No fried foods, no exceptions. No processed meats with nitrates, nitrites, no exceptions. Absolutely no oils. It means no margarines, no mayonnaise, no salad dressings, no cooking oils. To eat canned fish, you got to be packed in water, mustard, or tomato sauce. They cannot be packed in oils. Then I want you to give up all gluten. No wheat, barley, rye, or oats. You got to live like an Asian. You have to live on rice and sweet potatoes and squash. They have to be baked in butter. You can have vegetables, but I would rather have them steamed as opposed to raw. Steamed vegetables will be healthier and better for you. Also, I want you to stay away from things like peanuts. You got to stay away from oxidized oils, and peanuts are amongst the worst. I do want you to eat animal protein with every meal: eggs, red meat, chicken, fish. You don't have to eat them all at the same time, but you got to read labels and ask questions when you go to restaurants. There's wheat flour used to thicken tomato soup. There's wheat flour used to thicken gravy. There's breadcrumbs used to put into meatloaf as part of the standard recipe for meatloaf. There's wheat flour used in everything. They scattered on even baked fish or poached fish to slightly brown it. And so you got to ask and make sure. Tell them you're going to fall down and bleed to death in the middle of the restaurant if you contact wheat. You can't have any wheat. No wheat, barley, rye, or oats. That includes beer, scotch, and bourbon. No wheat, barley, rye, or oats. No oatmeal, no cereals, no pasta. If you're going to eat noodles, that would be rice noodles from an Oriental food store. All right? You can have pancakes, but they got to be buckwheat pancakes. You can go to just about every store now has a gluten-free aisle. Then at 173 pounds, I want you to have 2 Healthy Start packs per month, 1 full dose of each of those 3 products at breakfast and dinner, 3 selenium twice a day. That's 2 bottles a month. The de-stress capsules, 3 of those twice a day. That's 2 bottles a month. And get your ORIC points above 100,000 with the triple free chocolate and or the Cell Shield RTQ. Call me every 2 weeks if you would, David. Give me a progress report. We'll walk you through this because this is a fixable thing, and you will be one of our poster boys when it comes to IBS. Well, thank you, everybody. Really great testimonies and great questions today. Thank you so much, Doug and Easton. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs, and God bless America.